so as you saw from our opening video, today we are going to be talking about body planes and directional terms. And body planes are a way that we divide the body up when we're talking about it in healthcare. Directional terms are how we talk about one body part in relation to another body part or one organ in relation to another organ. Why do you think it's important that we have set terms that we use in healthcare to have these conversations about patients? Good. We want to make sure that everybody is using the same language so that we're all talking about the same thing. So we're going to go through, we watched it in the video, but we're going to go a little bit more in depth. So our goals today are that by the end of this presentation, you will be able to demonstrate what correct anatomical position is, that you can identify the 4 body planes used in the study of anatomy, and that you can describe the human body using directional and regional terms. And in front of you, you all have your body organizers. You're going to be taking notes on those as we go. So as we introduce each term, I want you jotting down notes in those columns. Good, guys. Okay, so we made it through those 4 body planes. So let's review. Our 4 body planes are frontal, oblique, sagittal, and
transverse.
Transverse, awesome. So now that we know how we can divide the body when we're talking about it, we're going to talk about some more specific terms to relate to those sides. So we talked about that frontal or coronal plane dividing us into front and back sections. When we talk in terms of anatomy, we refer to the front as anterior. So anterior means front or towards the front of the body. The back side is known as posterior. So posterior is the back or toward the back of the body. One way that might help you remember this is that in the alphabet, A comes before the letter P. So front, before, back. Anterior, posterior. Just to make things a little more complicated, there are often more than one term for medical terms. So you may hear the anterior portion referred to as the ventral side of the body. Ventri, the root word ventri means stomach or abdomen, which is on the front of our body. And a way to remember that is that if you've ever heard of a ventriloquist, what's a ventriloquist do? Does anybody know? Yeah.
They use puppets, but they try to talk for them without letting you see that you're talking.
Absolutely. So to do that, they talk from their stomach. We call ventriloquist, that ventri stands for stomach talker. So if you think of a stomach talker, you think front or anterior part of the body. The other term you may hear for posterior is dorso, which a way to remember that is, does anybody know what the fin is called on dorsal fin? A dorsal fin, good, and that is on the back of those. So dorso-posterior, anterior, or ventral. So we're going to practice. If we are talking about these 2 stars, we're talking about locations in the brain, what would you say the relationship of this red star is to the green star? The red star represents the frontal lobe, and the green star is representing the occipital lobe. You want to guess? Sure.
The red star is anterior.
To the
Posterior.
Good. So the red star or the frontal lobe is anterior to the occipital lobe, or you could say the occipital lobe is posterior to the frontal lobe. Very good. The next way you can divide the body is that horizontal plane, or what was that one called? Transverse. Good. Transverse, that divides us into a top and a bottom. But instead of saying top and bottom in medical terms, we talk about superior and inferior. So superior means above or towards the head. One way to remember that is that we refer to our head as our skull, which starts with an S, so superior skull. Inferior means below or away from the head. So inferior, one way you can remember that is that it has an F in it, which is floor. So inferior is below, superior is above. And of course, There are other terms we can use for that. So the other term you might hear for superior is cranial. Why do you think we call it cranial? Yes?
Because your head's called a cranium.
Good. Our head, the medical term for our heads are craniums. So if you see that cranial, that means towards the head. The other term is caudal. Does anybody know what caudal stands for? Caudal is the medical term for tail. So caudal, think below or tail. Cranial, think above or head. So here again, we've got a practice. So we've got this red star that's on the heart, and we've got a green star that's on the stomach. So if we were going to make a statement about their position in relation to each other, what would we say? Go ahead.
The red star is superior and the green star is inferior.
Good job. So that red star or the heart is superior to the stomach. Or you could say the stomach is inferior to the heart. We have that second top-down vertical cut, and what was this one called? Good, starts with an S.
Oh, wait.
Sagittal or side, good job. So we talked about that mid-sagittal or midline, that imaginary vertical line down the middle of the body. And when we're talking about right and left, we talk about medial or lateral. So medial means towards the middle. So M, middle, medial. Medial towards the middle, lateral away. And a way you can remember lateral is that if you know what these muscles on your back are called, on the sides of your back, those are called your lats. So think lateral, side of the body, medial, middle of the body. We're gonna practice here. So if if a woman came in with 2 spots on her face, green spot 1 and a red spot 2, how would you talk about those when you're describing them with medical terms? Sure.
The red dot is medial.
Good.
And
To the
Green spot.
good. So spot 2 is medial to spot 1, or you could say that spot 1 is lateral. Good. Think of your lats to spot 2. Last one. I know this is a lot of note taking and listening, but this is our last one here. The last terms that we use when we're talking about anatomy is superficial versus deep. So who knows what superficial means? Yeah, on the surface. So closer to the surface of the body. Superficial, think surface. And deep means farther in. So away from the surface of the body or deeper. So if we were talking, and it's a little bit, we're gonna get, but if we were talking about anatomy, you might be talking about a structure that sits further in the body as opposed to one that's closer to the surface, and you would talk about those as being superficial or deep. So here's our practice. If we were talking about the skin, the ribs, and the lung here, how would you describe their relationship?
Skin is superficial to the...
Good. Do you have another one?
The ribs are deep compared to the skin.
Good, very good. So the ribs are deep compared to the skin, but the ribs are superficial compared to the lungs. So it's all about what's in relation to each other, and that's why we have these terms, so that we can describe things in relationship to each other. Okay, so that is the end of our lecture. Our next activity, you are all gonna you're gonna partner up, so you're gonna get a partner. Then you're going to come and get a gummy bear lab. So everybody's gonna get 5 gummy bears. They're gonna get their piece of paper and they're gonna get a scalpel, and we are going to do gummy bear dissections. So you'll need your instructions, your gummy bears, your scalpel, and a piece of paper. And you and your partner are gonna work to make these cuts that we've learned about into those 4 planes. and then to describe those those anatomical directional terms based on what you see with your teddy bears. If you have questions, raise your hand. When you and your partner think you are done with your dissections, please raise your hand so that I can come check you off.